I'm here near Sathergate, where students have organized for what they call a die-in for healthcare reform. With a bipartisan healthcare session set to be held by President Obama on February 25th, these students are attempting to have their voices heard through silent solidarity. At 11 a.m. on Wednesday morning, 25 students gathered together and died for 26 minutes in a protest against the current healthcare system. The students were protesting the rising premiums for private health insurance and cuts in coverage, issues they argue are non-existent in other developed nations.
The fact of the matter is healthcare costs huge sums of money right now. It's around like $12,000 for job-based employment, and it's expected to double by 2016 if we don't provide a remedy. And our goal here is to more so generate awareness of the problems with our whole healthcare system, the fact that it's structured for the benefit of drug companies and the medical associations to make profits at the cost of the quality of our healthcare.
This demonstration was organized by CalPIRG, a California-based interest group, one of whose mission is healthcare reform. As you can see behind me, the students are physically on the ground representing the 20,000 or so Americans who die annually because they cannot afford medical insurance. President Obama and the Democrats pushed for healthcare reform, and the House passed a bill on November 7th. However, reform came to a standstill during the bill's reconciliation between the houses, when the Democrats lost their 60th Senate seat, once held by Senator Edward Kennedy, leading to threats of a Republican filibuster.
Well, on the national level, there's three things that would be really amazing. One, if we implemented a public health insurance option that would compete with private companies and drive down the cost of it for everyone, as well as giving something that poor people could opt into. Two, cutting administrative expenses. And lastly is banning pre-existing conditions, because insurance companies shouldn't be able to discriminate against you just because you have a chronic illness. And people shouldn't be dropped from coverage because they have a chronic illness.
Bitter tensions have emerged in bipartisan talks, with the Democrats arguing that government intervention is necessary to extend coverage to the tens of millions of citizens who currently live without medical insurance. The Republicans, however, feel that a free market system will lower healthcare costs. In a time of economic uncertainty, where millions of Americans are living without health insurance, the U.S. citizenry looks toward the government for an answer. This is a statement of a larger issue, one that has divided the nation and furthered the divide between the parties. But through this demonstration, through this die-in, these students aim to play their part in a national mission toward reform and give a voice to what they argue are the silent victims. For Cal TV, I'm Jake Lafferman.